Hi, welcome back, guys. So today's video is going to be talking about, midwifery in the UK, how it is like, everything about it. Okay, keep watching. Hi, welcome back. So it's good to have us back here again. My name is Joy Gonoje, and you're watching this video from my channel. And today's video, like I said, is going to be, describing or telling you about telling you about midwifery experience in the UK, like working as a midwife here in the UK, what's all about. And I've been here for like almost a year now, 10 months, and it's been an amazing experience so far. If you tell me to choose between nursing and midwifery in the UK, I would gladly go for midwifery 10 times, like, because it's really so amazing. Like practicing as a midwife here, it's been an amazing journey. The reason why I'm saying this is that the whole working experience, yeah, you're working 12 hours. So what we do, we work 12-hour shift, like every day for 3 days. We work 12-hour shift. It's 7:30 p.m. to 8 p.m. 7:30 a.m. to 8 p.m. That's like 12.5, but it's 12 hours. And then you get a 1 hour break, like you get 1 hour to 45 minutes to 1 hour break. And then you're so what you're doing as a midwife, if you're working in the labor ward, say you're working in delivery suites, which is the labor ward, you get allocated to a particular patient. Maybe a patient is in labor, and if the patient is in active labor, you're going to be giving one-on-one care, meaning you're going to be staying with the patient in the patient's room till the patient delivers. Or if anything happens, maybe it requires cesarean section at the end of the day, you're going to go with the patient to the theater, to assist with the delivery and everything else, assist to make sure that baby is okay. And so when you're at the theater, for instance, you what all that you're doing is just you know trying to make sure that the woman is comfortable, continue giving the emotional support, and then and when the baby is brought out by the surgeons, you take the baby from them and clean the baby up, make sure the baby is breathing, the APGARs are fine, and baby is well taken care of. You promote breastfeeding, continue to support them until they are transferred to the recovery room. So that's by the way for that. And so for the one-on-one care, say a woman is in active stage of labor, you know what active stage is as a midwife, like, you know, dilating actively, contracting, and or for instance, is an induction, and then you're giving the labor care. You have to be with the woman. You have to be there. You have to keep on monitoring. If the woman is placed on continuous monitoring, that's the CTG, you have to make sure that you're with the woman 247. You're always in the room with the woman, giving her the support, ensuring that baby is okay, the heart rate is all right, and doing or giving all your labor care, as a midwife, giving all your labor care that is due as at when due. You understand? So that's all about, giving that one-on-one care. So that's what I love so much about, um the delivery suite. The delivery suite, that's what I love. The one-on-one care is what I love about the delivery suite. And we also have the postnatal ward. We have the antenatal DAU, day assessment unit, as well. So the postnatal ward there is for ladies that have already put to bed, they've delivered, and then they are transferred from the delivery suite to the labor ward, to the postnatal ward rather. So when they are transferred, we have a lot of them there. And then you are a midwife there. For instance, there are say 4 5 midwives on duty that day, or three, depending. You get allocated a particular number of patients, a particular number of ladies to look after. It might be 4, it might be 3, depending on how many people are in the ward that particular day. So all you're doing as a midwife, you're giving the postnatal care to both the mother and the baby, making sure they are in good condition. If there is any test that needs to be done, you're doing that. If monitoring urine, output, fluid intake, and all of that, promoting breastfeeding as well, giving all those necessary cares, And also you are the one to discharge them as well if they are okay at the end of the day, like they don't require any other investigation, they don't require any other care, and it's time for them to be discharged. You are the one to discharge them, make sure their paperwork are printed, and then have them go home and all of that. Make sure that you give them enough information on their community care, because when they get home they are going to be visited by the community midwife as well, the head visitor and all of that. And also they are going to go to the GP to make sure that they do all their go to their necessary appointments. So remind them about that, remind them about how to take care of themselves, postnatally, after birth, what to do, what not to do, how to take care of baby, how to report if there is any issue arising, like if there is any concerns they are having, maybe with bleeding or with baby or anything else, to come back, or the to call the wards for them to come over, or if there's any advice you can give to them on the phone, you give it to them. So that's all about the postnatal ward, and which is still sweet, which is still okay, very okay. And the day assessment unit now, the DAU, is just all about like antenatal care. So comparing it to Nigeria, it's just like our antenatal care clinics, where you give those normal antenatal care, routine antenatal care. The ladies come to you on their appointment days, and you monitor them, palpate, monitor baby, monitor mom, do observations, make sure they are okay, give routine medications and all of that, and doctor's appointment if they need it. You understand all those things that you do in normal antenatal care clinic. And then the DAU is like say for instance a lady's having concerns, they called, they are having concerns that are home, and they're having concerns with baby movements, and they called you, so you refer them to the DAU. They come to the DAU to see you. You monitor baby, place them on the CTG, make sure that okay, everything is okay with baby, everything is okay with mom. If they are there to see the doctor as well, they see the doctor too. They get their doctor's appointment from there, and also to do any scans. For instance, they have scan appointments. They go to the DAU to do that, the day assessment unit, to do that as well. So we also have triage. So triage is just like as the name implies, you are triaging, like okay, this different ladies come to you. The triage is like similar to DAU, it's like similar to the day assessment unit, where a lady comes to you for complaint, like they are having some, maybe they are ill or something, or they are having concerns with baby movement, or they are having any concerns at all with baby or themselves. They come to you, and then that you're going to give them care within like very fast, like 15 minutes, or at least within like a short period of time. So you have to be very fast in triage. You have to make sure that also you are able to triage, okay, this between this lady and this lady, I think I should take care of this one first, so that it doesn't escalate, it doesn't get worse, the condition doesn't get worse. So you are triaging, okay, which one should I attend to first, which one is more urgent, and all of that. So that's what you basically do in that. Then we have the community, where women go to for like the normal antenatal clinics. So the community, if you're a community midwife in the UK, all you do is like what we do, like similar to care, midwifery care in the UK, like our antenatal clinics, routine antenatal clinics. So the ladies come to you in the community hospital, call it the hub, and when they come to you, you give them routine antenatal care, palpate the abdomen, make sure that baby is feeling okay, baby is all right, it's in a good position, and then you give the routine, care and everything else, make sure they are fine, and then book them for another appointment as well if everything goes well. And if they need to be referred to the hospital, like they need to see a doctor or they need to do their scan, you give them the referral as well, and make sure they are they are appropriately referred. You understand? So that's just basically everything about the community midwifery. And then the community midwives as well, they go for home visits. Say for instance the woman is not able to attend her clinic, or the woman has delivered, they go home to see the woman, make sure that everything is okay, baby is fine, mom, dad is fine. And if the woman is not able to attend her clinic, they go home, they give her the antenatal care at home as well. So it's very, very enticing. It's really, really enticing, and it's absolutely amazing. And I love being a midwife in the UK. I don't know about you, but I love being a midwife in the UK, and I actually prefer it. I actually prefer it to nursing in the UK, like practicing as a nurse here, because all these other tiny bits and pieces, they are not there when you are a nurse. Yes, you have different words, you work as a nurse, you have different things, but all this, you know what I mean, like it's so dear to my heart, like being a midwife. I love being a midwife. It's my passion, it's my tribe, and that passion keeps me going. And then the way it is arranged, the way it is, you know done here, makes it even more better for me. I actually love it. So that's just all about that. And I hope you enjoyed this video. If you're yet to subscribe to my channel, please, this is the right time to do so. Okay, do it, subscribe, and turn on the notification bell, and I can't wait to have you back. Bye bye.